Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Perceived Stress Scale assesses the degree to which individuals perceive their lives as unpredictable, uncontrollable, and overloaded. It measures psychological stress by evaluating feelings related to the ability to cope with stressful situations. The main purpose of the scale is to quantify perceived stress levels in various populations to aid in the identification of individuals at risk for stress-related health conditions such as hypertension, anxiety disorders, and depression. The scale provides valuable data for clinical assessments and research studies focusing on the impact of stress on physical and mental health outcomes. The Perceived Stress Scale is indicated primarily for adult populations experiencing varying levels of psychological stress. It is widely used in both general and clinical settings to assess subjective stress responses. The scale is particularly useful among patients with chronic illnesses such as cardiovascular disease, diabetes, and cancer, where stress has been shown to influence disease progression and treatment outcomes. It also aids in evaluating stress in psychiatric populations, including those with anxiety and depressive disorders. In clinical practice, the tool facilitates monitoring stress variations over time, supporting interventions aimed at stress reduction and coping enhancement. Its application extends to preventative healthcare by identifying individuals at risk for stress-related health complications. The Perceived Stress Scale consists of 10 items that assess the individual's perception of stress over the past month. Each item presents a question related to feelings and thoughts about stress, such as feelings of control, confidence, or overload. Respondents select their answers using a 5-point Likert scale, ranging from 0 for never to 4 for very often. To administer the scale, instruct the individual to read each statement carefully and choose the response that best describes their experience. Reverse scoring applies to 4 positively stated items by subtracting the selected response from 4. The individual scores for all items are then summed to produce a total score between 0 and 40. Higher scores indicate greater perceived stress levels. Reference ranges suggest that scores from 0 to 13 represent low stress, 14 to 26 indicate moderate stress, and 27 to 40 correspond to high perceived stress. Clinicians should interpret the results within the context of the patient's overall clinical presentation and consider repeated assessments to monitor changes over time. Sensitivity refers to the ability of a test to correctly identify individuals who have a condition, while specificity refers to the ability to correctly identify those who do not have the condition. In the context of the Perceived Stress Scale, sensitivity reflects the proportion of truly stressed individuals accurately detected by the scale, and specificity indicates the proportion of non-stressed individuals correctly classified. Reported sensitivity values for the Perceived Stress Scale vary across studies but generally range from approximately 75% to 85%. Specificity estimates similarly fall within the range of 70% to 85%. For example, a sensitivity of 80% means that 80 out of 100 individuals experiencing significant stress will be identified using the scale, whereas a specificity of 75% indicates that 75 out of 100 individuals without significant stress will be correctly recognized as not stressed. These values suggest that the Perceived Stress Scale is moderately accurate for screening purposes in clinical settings, but may require complementary assessments for definitive diagnosis. The Perceived Stress Scale was developed in the early 1980s by Sheldon Cohen and colleagues as a measure to assess the degree to which situations in an individual's life are appraised as stressful. Its initial validation involved a sample of over 800 adults in the United States, demonstrating strong internal consistency with Cronbach's alpha values, typically ranging from 0.70 to 0.86 across various studies. Test-retest reliability over intervals spanning 2 days to 4 weeks has been reported to range from 0.52 to 0.85, indicating moderate temporal stability. Construct validity was established through significant correlations with measures of life event stress, depression, and physical symptomatology. Subsequent research has confirmed the scale's factorial structure and cross-cultural applicability, with validated translations available in multiple languages. Further studies have supported its predictive validity for health outcomes related to stress, including immune function and cardiovascular risk. The perceived stress scale remains one of the most widely used instruments for assessing perceived stress due to its robust psychometric properties, documented through several decades of empirical research. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.